we will talk about Asperger syndrome,
one of 5 autism spectrum disorders.
The features of Asperger syndrome is social interaction deficits and fixated interests, beliefs, restrictive, repetitive behaviors and activities that impair occupational or other areas of functioning.
Some people with Asperger syndrome are very talented in their chosen field of interest.
The social communication deficits include lack of the normal back and forth conversation, lack of typical eye contact, body language, and facial expression, and trouble maintaining relationships. Sometimes Asperger syndrome is mistakenly referred to as mild autism. The prevalence of Asperger syndrome is 2.5 per 10,000. According to the National Institute of Health, the ratio of males to females with Asperger syndrome is approximately 6 to 1.
The term autism was conceived in 1911 by Swiss psychiatrist Eugen Bleuler, adapting the word from Greek autos, meaning self. Bleuler was describing individuals with schizophrenia who were disconnected from reality. In 1943, Leo Kanner, a child psychiatrist at Johns Hopkins University, adopted the term to describe a childhood disorder he regarded early infantile autism involving challenges in social and language in addition to the presence of repetitive behaviors. During the same period, an Austrian pediatrician, Hans Asperger, conducted a study on a small group of boys, in 1944, with similar challenges in social interactions. Lorna Wing, a psychiatrist in the United Kingdom, later revised Asperger's work in the 1980s and encouraged autism experts to view autism as a spectrum of challenges rather than one homogeneous disorder.
Asperger syndrome is a developmental disorder that affects how the brain processes information. It usually becomes obvious during childhood, at the age of 7, and remains throughout life, with varying degrees of disability.
The exact causes of Asperger syndrome are unknown, but they are thought to be genetic, environmental and cultural.
Characteristics of individuals with Asperger syndrome are difficulties in forming friendships, repetitiveness in language and actions, inability to understand the rules of social behavior, the feelings of others and difficulty reading body language and facial expressions. It is common that a person with Asperger syndrome has a narrow field of interest and unlike autism there is no delay in language or cognitive development.
Diagnosis of Asperger syndrome is complex and difficult by the lack of standardized diagnostic tests. However, it takes place in a 2-stage process, first a developmental screening and second, a comprehensive team evaluation to either rule in or rule out Asperger syndrome.
There is no cure for Asperger syndrome, but there are treatments.
ABA is a general term that encompasses intervention approaches designed to change behavior. It is commonly used for treating Asperger syndrome. Beginning of treatment should start as early as possible to capitalize on the brain's plasticity early in life. Speech therapy is common during the school years and drug therapy is beneficial in the management of specific troubling symptoms.
Younger students usually do well in primary school, with consistent classmates, the same classroom and the same teacher. It is when they move from this stable setting into secondary school confusion of different sets and multiple teachers that they are tested in their true degree of disability becomes apparent.
There are some options of sector colleges becoming better geared to students with special needs, but they are limited by their structure, funding and expertise. Students with Asperger syndrome are able to seek special funding for further education.
Prospects, a program run by the National Autistic Society, has been very successful in helping people with Asperger syndrome to get and retain jobs. Its experience has been of a workforce characterized by good timekeeping and the ability to get on with work that others might find too repetitive.
An individual with Asperger syndrome can fare quite well as a child, adolescent and adult.